Hello everyone, my name is Dr. Himanshu Dhawan and today I am going to address a very important question that many varicocele patients often ask. Is it possible to treat varicocele through alternate treatment like Ayurveda or homeopathy? While surgery is the most common conventional treatment, many patients try to approach alternate options that are non-invasive, have fewer side effects. And in this search, they get mostly confused whether to choose Ayurveda or a homeopathy to get rid of varicocele. So, to answer this common question, I believe it's essential to share insights based on a real patient experiences and scientific understanding. So, to illustrate this, I have some report to share with you. You can pause the video to examine the before and after reports, and in this particular cases the patient was dealing with both hydrocele and varicocele. So the latest report shows that the varicocele issue has been completely resolved, while the other hydrocele has now reduced to a mild state. Before indulging deeper, let's briefly understand what varicocele and hydrocele are. Varicocele is a condition characterized by enlarged veins within the scrotum. It can lead to discomfort and potential infertility issues. And hydrocele, on the other hand, is a fluid-filled sac surrounding the testicles, which can also cause swelling and discomfort. When patients present with multiple complications like this, it can complicate the treatment process also. For instance, the presence of hydrocele may cause fluid retention, making it more challenging to treat alongside varicocele. In such cases, doctors may need to allocate extra time for recovery, as each condition can affect the other. In the treatment of the patients, we initially focused on addressing the varicocele. Treating varicocele can sometimes be easier than hydrocele, especially if the fluid is in the hydrocele is gradually decreasing. This gradual reduction is often a positive sign that the hydrocele might eventually resolve on its own. In this particular case, the patient's recovery took about 3 to 3.5 months, and this time frame is considered good, especially given the severity of the varicocele, which was graded between the second and the third stages. The higher the grade, the more time it typically takes for recovery. It's important to note that while varicocele recovery was achieved in a reasonable time frame, the hydrocele presented some ongoing complications. Additionally, the patients developed epidermal cysts which began to grow. While these are the typical, not serious, they can add the complexity to the treatment process. So now let's address the main question, can one recover from varicocele using alternate medicine? The answer is a clear yes. However, it's important to understand that efficacy of a treatment can vary significantly from the patient to another patient. Throughout my experience, I have encountered patients whose treatment duration have varied widely. Some patients achieved recovery in as little as 3 months, while others took 6 or even 10 months. So this variability is normal and reflects individual differences is how bodies respond to treatment. Another crucial aspect to understand is that neither Ayurveda nor homeopathy can guarantee a specific recovery timeline. While one might hope for results within 1 or 2 months, it's a body responses to a treatment that ultimately determines the outcome. So this means that it's essential to maintain patience and allow your body the time it needs to heal. If you are currently receiving a treatment, whether it's a homeopathy or Ayurveda or any other form of alternate medicines, it's vital to monitor your progress. Signs of improvement can include a reduction in symptoms such as less pain or swelling. For example, if you notice that the discomfort in the affected area is decreasing, or if the veins appears less notable, these are the positive indicators that the treatment is effective. However, if you find yourself on the same treatment for over a year without any check-ups or evaluation, it may be time to reassess this. Sometimes long-going treatments without monitoring can raise the questions about its effectiveness. So, regular checkups can help you understand if your treatment is working or in adjustment are needed. I always encourage this patient to get regular health checkups, especially if they have been on treatment for an extended period. It's essential to have your conditions evaluated periodically to ensure that your treatment is on the right track. If you notice improvement in your reports, such as decrease in varicocele measurements or resolution or symptoms, that's a promising sign. On the other hand, if your symptoms continue or worsen despite ongoing treatment, it may indicate that the current approach needs modification. For example, you might want to consider a semen analysis test. This test can provide valuable insights into the fertility potentials and overall reproductive health, and it's a relatively easy to obtain. One of the amazing aspects of the body is its ability to heal itself with the right treatment and the lifestyle adjustment. Many patients can experience the significant improvement over the time, and your body has a mechanism for self-healing, which can play a crucial role in a recovery from the conditions like varicocele or hydrocele. If you observe positive changes such as reduced swelling, less pain, or improved overall well-being, it often means your body is responding well to treatment. It's essential to listen to these signals and continue with therapies that seem to be yielding results. Recovering from varicocele through alternate medicine is indeed possible. Each patient's journey is unique and treatment duration can vary. Regular monitoring, open communication with your doctor, and a commitment to self-care are very important for achieving the best outcomes. If you found this video informative, then please consider sharing it with others who may benefit. Your support can help spread awareness and provide hope to those dealing with similar conditions. Thank you for joining me today, and I look forward to seeing you in our next video. Until then, take care and goodbye.